This is the inside story of Chicago's famous Mercy Hospital and a community now begging for mercy as the hospital's owners say they've decided to close. Mercy opened for business in 1827. Tonight, the I-Team looks at one decision that would leave thousands of Chicago patients and employees stranded and why a wave of critical health services are vanishing from predominantly black neighborhoods.
I've been in a 9-year battle of fighting for my life.
From multiple sclerosis to open heart surgery and now stage 4 breast cancer, Tracy Lyons' medical odyssey is far from over. Most of her care delivered at Mercy Hospital. Her confidence in the institution is unshaken even after a mass shooting in 2018.
You could hear the bullets bouncing off the car.
Lyons was in Mercy's parking lot that chilly November afternoon when a gunman opened fire. She ran back into the hospital where she says 2 nurses kept her safe.
We locked ourselves in the utility closet. Those nurses, they prayed with me.
The violence left 4 dead, a police officer, a physician, a pharmacy technician, and the gunman. Lyons says despite the scare, she would never give up on Mercy because it's never given up on her.
Look at me, I'm still alive.
Lyons joins a growing chorus of outrage as community activists, politicians, and healthcare workers demand action from city and state leaders to prevent the planned closure early next year. Mercy Hospital sits in the Bronzeville neighborhood just south of downtown. It's what's known as a safety net hospital, meaning it provides care to vulnerable patients regardless of their ability to pay.
We take care of everybody that comes to the door.
According to state records, the majority served are low income and people of color, many elderly and suffering from chronic diseases. Urologist John Kudecki, a longtime Mercy doctor, says without this teaching hospital, roughly 1,700 employees will lose their jobs. Countless patients may delay or forego care, and the South Side will become a healthcare desert.
They do 50,000 emergency room visits a year and 3,500 elective surgeries a year. So that's going to be tough to absorb, especially when there is really no place on the South Side to absorb that.
State Representative Lamont Robinson, whose district includes Mercy, says losing the hospital will only widen an already unacceptable racial health care gap in Chicago.
Chuck, most definitely this is a racial component.
Last spring, Robinson and other lawmakers declined to support a proposed merger of Mercy with 3 other financially struggling hospitals, claiming it was an ill-defined plan. The merger fell through. Now the freshman lawmaker is telling the I-Team new negotiations are underway.
There are other groups that have reached out to me that want to acquire the hospital. And so I'm working diligently with those groups and the governor's office to keep the hospital open. But we need Mercy, Trinity, the parent company, to entertain those offers.
Mercy Hospital, which is owned by Trinity Health, declined an on-camera interview. In an email statement, it said, Trinity welcomes inquiries from legitimate potential buyers who have adequate funding to meet the operating and capital needs of the hospital within the time frame that's been laid out. It details how Trinity has invested hundreds of millions of dollars in the hospital since 2012, has worked hard to find potential buyers, and is disappointed the merger plan was not approved by legislators. The statement also says a remaining challenge is there are too many empty hospital beds on the South Side. It also cites ongoing operational losses of $4 million a month. A lifeline for Mercy will not stop the steady erosion of urban hospitals. The ABC7 I-Team analyzed data spanning 20 years and discovered an upsurge in Chicago and Cook County hospital closures. In that time period, 22% of Cook County's hospitals have closed. That's nearly 1 in 4. 8 hospitals have closed in Chicago alone. 23% of city hospitals gone in just 2 decades. Mercy would be the 4th hospital to the south or west closed since 2018.
We're only in the early stages of this pandemic. That's going to put real strain on hospitals in Chicago, and I will not be surprised if we see another 4 or 6 hospitals close in the next 18 months.
Governor Pritzker recently saying it's possible lawmakers will provide money for Mercy and other troubled Southside hospitals when they return for the fall veto session in mid-November. Mercy and now Northwestern Medicine have announced separate plans to build outpatient facilities in the Bronzeville area, a growing trend in health care as more hospitals hit financial breaking points.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.